like to keep some things to myself. I'd like to keep my shoes drawn.
In this presentation, we will focus on a group of disorders called anxiety disorders. Anxiety and fear play an important role in understanding these disorders. Anxiety is defined as an apprehension over an anticipated problem, while fear is immediate, versus anxiety, which is anticipated.
Fear tends to be about a threat that is happening now, whereas anxiety tends to be about a future threat. For example, if someone saw a bear, you would be fearful for your life, whereas if you have an exam coming up, you'd be anxious about it.
Like anything, anxiety disorders are surrounded by stigma. One of the main forms of stigma is people claiming they have an anxiety or panic disorder, but not actually being diagnosed. Other stigmas include labeling the person suffering from anxiety as being weird, rude, introverted, paranoid, or even that they have a personality disorder. All these things are untrue. Anxiety isn't something you should joke about or take lightly.
While in college, there is professional help that one can seek to get aid. CAPS, Counseling and Psychological Services, are there to talk about any problems and help you work to a solution. It is also completely confidential, so you never have to worry about anyone finding out. CAPS is there for all college students to use, so take advantage of it to help you in your mental health.
In this presentation, we're going to cover generalized anxiety disorders, specific phobias, agoraphobia, panic disorder, and social anxiety disorder.
Moving on to panic disorder. A panic disorder is defined as an anxiety disorder based primarily on the occurrence of panic attacks, which are recurrent and often unexpected. At least one attack is followed by 1 month or more of the person fearing that they will have more attacks. This causes them to change their behavior to avoid situations that may induce a panic attack. According to the DSM-5, the attacks are not due to a drug or general medical condition, and they are not better accounted for by another mental disorder. These may include a social phobia, obsessive-compulsive disorder, post-traumatic stress disorder, or separation anxiety disorder. The attacks are characterized by 4 or more of the following symptoms: heart palpitations, pounding heart or increased heart rate, sweating, trembling or shaking, shortness of breath, feeling of choking, chest pain or chest discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, feeling detached, the feeling of losing control or going crazy, the fear of dying, numbness or tingling sensations, or hot or cold flashes. Specific treatments for panic disorder include psychotherapy, otherwise known as talk therapy, cognitive behavioral therapy, known as CBT, or medication. Medications could include SSRIs and SNRIs, which are antidepressants, and or benzodiazepines, which are central nervous system depressants.
Next disorder we will be talking about is social anxiety disorder. For those who experience this under the DSM-5 criteria, have marked or disproportionate fear consistently triggered by exposure to potential social scrutiny, or exposure trigger leads to intense anxiety about being evaluated negatively, or trigger situations or avoided or else endure with intense anxiety. For example, there might be someone who's married to another person and will only talk to this person in fear of talking to others to get negatively scrutinized. They might potentially avoid going to supermarkets or other public spaces they may have already be familiar with because they're afraid of what others will perceive them as. Now think back to the last time you were asked to present in front of a class. Did you feel shy? Were you anxious about the presentation? Did you start fumbling over your own words? Shyness and social anxiety disorder are 2 different things. For example, shyness is a personality trait. Many people who are shy do not have the negative emotions and feelings that accompany social anxiety disorder. They live a normal life and do not view shyness as a negative trait. While many people with social anxiety disorder are shy, shyness is not a prerequisite for social anxiety disorder.
A specific phobia is any kind of anxiety disorder that amounts to an unreasonable or irrational fear related to exposure to specific objects or situations. As a result, the affected person tends to avoid contact with the objects or situations, and in severe cases, any mention or depiction of them. The fear, in fact, can be debilitating to their daily life. DSM-5 describes 5 types of specific phobias: animal phobias, natural environment phobias, blood injection phobias, situational phobias, and other phobias. We will take a look at each of these. The DSM-5 criteria for diagnosing a person with a specific phobia includes fear or anxiety about a specific object or situation. The object or situation almost always provokes immediate fear or anxiety and is avoided or endured with intense fear or anxiety. The fear or anxiety is out of proportion to the actual danger posed by the specific object or situation and to the cultural context. The fear, anxiety, or avoidance is persistent. It typically lasts for 6 months or more and causes significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not comorbid with another explained disorder.
Agoraphobia is an anxiety disorder in which a person has a fear of places that may not be easy to escape. It may cause embarrassment, and it may make them feel trapped. According to the DSM-5, these situations consistently provoke fear and anxiety. It can cause panic, helplessness, or embarrassment. These settings are avoided and usually require the presence of a companion if they needed to go there. Symptoms include rapid heartbeat, trouble breathing or choking, chest pain, dizziness, sweating, upset stomach, fear of losing control, or dying. Some stigmas associated with this behavior is being called emotionally unstable, crazy, and weird. A few examples are crowded places like parties, even elevators, and crowded stairwells. Treatment plans for this disorder include professional help. There are specific antidepressants and anti-anxiety medications used to treat agoraphobia. Professional support can also help one overcome this phobia. Some tips are: stick to your treatment plan, learn calming exercises such as deep breaths, and try to avoid fear situations.
Generalized anxiety disorder's defining characteristic is worry. It is defined by excessive worry about people, events, and things that do not pertain an immediate threat or any threat at all. Excessive worry means worrying even when there's no specific threat or in a manner that is disproportionate to the actual risk. People diagnosed with this disorder typically seek reassurance from others frequently. People living with this disorder worry about typical everyday life events like everyone else. They just take it to a whole nother level that begins to impact their daily function. It typically begins in adolescence, and once it develops, it becomes chronic, meaning they will carry it with them for the rest of their lives. The DSM-5 criteria for generalized anxiety disorder is 1. Excessive worry and anxiety at least 50% of days about a number of events or activities. 2. The person finds it hard to control their worry. 3. The anxiety and worry are associated with at least 3, or if they're a child, only 1, of the following: edginess or restlessness, tiring easily or more fatigued than normal, impaired concentration or feeling as though the mind goes blank, irritability, which may or may not be observable to others, increased muscle aches or soreness, and difficulty sleeping. For these symptoms, they have to be unrelated to any other medical condition and cannot be explained by the effect of substances including prescription medications, alcohol, or recreational drugs. They also may not be better explained by a different mental disorder. Treatment includes medication, including antidepressants and anti-anxiety medications, and therapies including psychotherapy and cognitive behavioral therapy. For the stigma portion, when they reveal their problems, they may be seen as dramatic or crazy. The person they are revealing their issues with could even say, everyone is dealing with the same issue and you need to learn to deal with it. Their friends and family may begin to see them as fragile and begin to interact with them less to not hurt them, but this is the time when the person living with general anxiety disorder needs the most support.
Stigma in the mental health world is an ongoing issue, and anxiety disorders are not excluded. It is common for someone with an anxiety disorder or other psychological problems to think that if they reveal struggles to friends or seek professional help, that they will suffer serious social or professional problems. It is common for someone to worry that others will see them as crazy. People with anxiety disorders might fear that others might view them as weak, because everyone gets nervous or anxious sometimes. But from our video, you know an anxiety disorder is much more than that.
While most studies show women are more vulnerable to anxiety, this difference could be from underreporting. Women are more likely to report symptoms than men. Men also might show symptoms differently. Another contributing factor is how society perceives gender roles, and that men are supposed to face their fears more than women.